Good afternoon, everybody, and welcome to the Healthcare Training in Virtual Environments webinar. I am joined by Jeff Bund from Varjo and Dr. Rafael Grossmann, who has over 25 years of surgical experience. And let's go ahead and move on to the next slide so you can see our lovely pictures that more or less match our faces right now. So the three of us are going to be talking a little bit about how you can really leverage virtual reality and biosensor tools in the healthcare space. So we can go ahead and move on to the next slide. You may be asking yourself, why would you use VR in the healthcare space in the first place? And the answer is that there have been a variety of uses for many years, ranging from phobia research to more recently surgical training and surgical research. And there have been many advances in recent years in virtual reality tools that have really allowed for the widespread use of this technology in different settings within the healthcare field. We'll move on to the next slide. Now, in just the last 5 years alone, there have been over 100,000 publications looking on VR and healthcare simulation. So the simulation space is really growing. And within the simulation space, over 22,000 publications focus on using these tools in a surgical training environment for surgical residents and medical students. And as with the VR technology, there have been major advances in the actual environments with which students actually interact to do their surgical training. So I have two examples shown in this image that actually show you some of the hyper-realistic tools that are available for students to really leverage these different environments for their surgical training. And these tools really allow medical professionals and trainees to properly leverage these tools in actually becoming better surgeons and better physicians. So if we move on to the next slide, a number of studies have been done on this, as I've already reported, and all of these studies show significant increases in performance as well as perceived self-confidence when the surgical interns are going through these different tasks. So these studies name a number of reasons for why the surgical training in the virtual environments can help above and beyond just the traditional techniques. And some of these reasons that stick out are an improved procedural memory or procedural process orientation with the different surgical tools that are available. Now, Dr. Grossmann will talk a little bit more about the procedural memory and process associated with surgery a little bit later on. But one thing that I've noticed is missing in some of these studies, not all, but some of these studies tend to focus on the full surgical experience and self-report or behavioral indices, which absolutely are useful, but they don't really tap into the underlying mechanisms that lead to these behavioral outcomes. So there may be certain aspects of the surgery that are deemed more cognitively taxing or more stressful, and self-report doesn't really tap at that. However, tools such as biosensors definitely can provide more insight into these underlying mechanisms. So if we go to the next slide, biosensors do indeed provide deeper insights into behavioral outcomes. Tools such as eye tracking that is built into virtual reality headsets provide insight into visual attention. So what elements of the surgical room are attended to? Are there key elements that aren't really attended to that should be? And you can associate that with other tools such as electrodermal activity or EDA that give you an index of underlying emotional arousal. Now, this emotional arousal can be associated with different motivational states, but when you really leverage these tools together, you get a deeper picture into what's going on as the surgical students are interacting with these virtual environments. This is wonderful, but historically, biosensor research has been a bit tricky to set up. Fortunately, we have a solution for you. So we go on to the next slide. iMotions provides a solution for you in that it actually streamlines biosensor research by integrating a number of these different modalities, such as eye tracking for visual attention and EDA for emotional arousal, as well as other biosensor modalities, and synchronizes them in one easy-to-use software. So if we go on to the next slide, I can tell you a little bit about how this works. Basically, our platform not only synchronizes all of these tools into one place, but it actually provides researchers with real-time live views of these signals that they can pair together for qualitative insights And then they can dive a bit more deep using some of the analysis and annotation tools that we'll cover a little bit later on for eye tracking to really aggregate across individuals and gain more insights. So on the next slide, I have a fun little example. In this example, we are actually using the Varjo headset paired with an EDA sensor in a phobia environment, let's call it. So my friend here is scared of spiders, and we can actually see whether she's visually attending to these oversized spiders and what her underlying emotional arousal is measured by the GSR. So we can actually see here, is she looking at the spiders? Is she looking away as soon as she sees them? Are there GSR spikes or EDA spikes when she sees them? And this is really useful to triangulate all of these together with the visual attention and the underlying emotional arousal. So the benefit of using our two tools together is that you can pair everything together nicely in one easy to use package and gain further insights in doing so. So if we move on to the next slide, I'm actually going to go ahead and let Jeff take over and talk a little bit more about what Varjo provides in virtual reality.
Yeah, thanks, Roxana. I'll keep this a bit brief, but I want to talk about a couple of the things in the Varjo headset that allowed us to do what we're doing today. Can you go to the first slide? Yeah, there it is. And so I'll focus on two main features. One is the human eye resolution, and the other is our integrated eye tracking. The first thing about our displays are that they deliver 20/20 human eye resolution to the user. And what that means is in our headset, you can look at everything like you could in real life. We call it 62 pixels per degree. Some people call it 1 arc minute. But basically, it looks very good and it looks very sharp. And then the other thing that's integrated into all our devices is an eye tracking system that was built, in parallel with the headset. So we have a bunch of advantages at Varjo in terms of the fact that we built an eye tracker that's designed to go into a headset instead of retrofitting an eye tracker into a head-mounted display. Could you go to the next slide, please? Yeah, so this exploded diagram shows how we accomplish what we do. So at the top, what you can see are two what we call focus or context displays. And then on the sides are our focus displays. And they're blended using a series of optics and mirrors that result in a very, very sharp image being delivered to the center field of view of the user. At the bottom of the diagram, you can see the rings and the other components that go into the glint system, which allows us to build our eye tracker both like elegantly integrated and also able to do really high performance measurements of eye behavior. Next slide, please. So it's always tricky to deliver this over the web, and we've had a lot of discussion at Varjo about how we communicate our resolution over the internet, but this slide is an attempt at that, and what you can see is the difference between a conventional enterprise headset and a Varjo headset. On the other headset, there's chromatic aberration, there's screen door effect, and there's general, lack of resolution and detail and blurriness in the image. And on the right side, in our headset, you can read the text, you can look at the buttons and dials, and you can interact with the controllers in a way that's much more lifelike. We found this is super important because an end user, a trainee, won't have to do things like lean forward, squint, or do other things when they're going through an experience that would introduce negative training or otherwise distract from the experience. Next slide, please. And then this graphic overlay shows how our tracker works. The green shapes are the structured infrared light, and they're shined into the light in a specific way that's integrated into our rear optics. And basically what it allows us to do is get really nice measurements of variation and distance in pupil movement. And our tracker is accurate to under 1 degree. And if you want to know what 1 degree looks like, you can hold your hand out, hold your thumb up, and the width of your thumbnail is roughly 1 degree of the field of view. So what's really cool about all this is that the resolution combined with the accuracy of the tracker allows us to get really nice information about what's happening in a training experience, because a trainee can read text or interact with fine detail, and we can measure that in equally as fine detail with the tracker. And what it basically leads to is just a really nice meta layer of analysis that can happen over a training or a curriculum. And the last slide, please. Yeah, and I'll just gloss over this, but this shows how this can be put into practice using heat maps and annotations, and how one might start using this. But I'll let Roxana and Rafael go into much more detail. Thank you.
Yeah, great. So I'm just going to briefly talk about what tools are available for healthcare training, because we've heavily leveraged one of the most advanced tools out there, and then I'll throw it over to Dr. Grossmann for more insights into what we did. So let's go ahead and go on to the next slide. So there are a number of different virtual surgical training environments out there, and the one that we heavily leveraged was created by Orama VR. Orama VR provides multiple healthcare specific training simulations that really use these hyper-realistic simulation-based training setups to allow surgical trainees to walk through the processes in a very procedural fashion. And make it as lifelike as possible with haptic feedback paired with the strong visualizations. So this is beneficial for surgical training because it's kind of a fail-safe environment. It's a little bit less of a risk than going straight to the more traditional methods. So we leveraged one of these. If you can go ahead and go on to the next slide. For a setup in which we had two novices, so myself and one of our colleagues go through a total knee arthroscopy, and I'm sure that I said that incorrectly, so I'll let Rafael correct me, where we actually walked through a training setup, and then we had Rafael go through it himself as an expert. And you'll see the replays in just a moment in what it looks like when you have novices who know nothing about surgery going through this virtual environment and quickly picking up the procedural memory and processes versus an expert who's been doing this for over 25 years. So if we go on to the next slide, I'm gonna just turn it over to Rafael and he can talk more about what we did.
Yes, thanks, Roxana. It's great to be here and have the chance to discuss a bit of this, which is a passion of mine. As a surgeon, I'm an educator, right? We train the next generation of students and next generation of doctors, of surgeons, and I've been for years passionate about how technology can really make us better teachers and better learners. And one of the things that excite me is exponential technologies like virtual reality, augmented reality, XR or extended mixed reality, right? And in any case, having the opportunity to work with Varjo is just amazing. I think I've had every VR headset in history in my hands at some point, or maybe in my face, I think. And but you know, we clearly see the evolution of the platform, of the hardware and the software. And the first time I used Varjo is really, I kind of jokingly call it, is like looking through a window. You know, you got that 20/20 human eye resolution, where you always have a little bit of a sort of TV on your face, right, when you put a headset, a VR headset. But with Varjo, it's like you're there, you're looking through a window, and the environment that you see there, it's just an unbelievable resolution. And there's no conflict of interest on any of these testimonies that I'm giving, by the way. But in any case, being able to immerse oneself in a surgical simulation, it has an incredible amount of benefits. Many of them are not even tangible benefits. The tangible ones are the ones that have been studied, after thousands and thousands of papers. Being able to, as a surgeon, when we do procedural learning and procedural teaching, it's important to remember, we always say, you got to know why you do the surgery, and you know how to do the surgery, so the step-by-step learning that is very important. Surgery is a sort of a spectator type of career. It's always a career as a student, but when you're learning how to do surgery, you are watching, someone do surgery, and you see how to do surgery. You watch it, and then people say, the old surgical adage is that you see one, you do one, and then you teach one. It's kind of the same way. But that seeing the surgery is what has changed over the years. We would still, you're an apprentice. You're kind of watching someone do surgery and learning how to do it, learning all the steps, and then you kind of try it with help, and then you kind of do it on your own, and then you teach someone how to do that. Having the opportunity to not work, obviously, on intuitively, obviously not on patients directly to learn, but maybe on mannequins, right? And now on digital patients, and digital virtual subjects, like a VR simulation allows us to do. So having the opportunity to put a headset, which is almost like looking at a real a subject, human subject in there, and having the platform evolve in such a way, like Orama VR has created this platform that is like being inside the OR. So when you put that headset on, you're inside the OR, just like the video that I have there, which is a real OR, obviously, and you see me kind of, moving in space, but inside the Varjo, I am in this digital OR, and I have the subject in front of me, or at least part of the subject. I just see that big knee there. And by the way, I'm a trauma surgeon. I do trauma surgery and acute care surgery, and half of what I do is elective surgery. I'm not a bone doctor. I'm not an orthopedic surgeon. So as a trainee many years ago, I did a lot of orthopedic surgery and some arthroplasties, which is basically reshaping a knee, right, or giving you a new knee. But this was interesting for me as a general surgeon who does kind of almost every kind of surgery except bone orthopedic surgery, to have this platform, because I was sort of an expert, but really I was a novice in that sense because I hadn't done it for so many years. But then the learning curve is pretty quickly, and one of the reasons is that it's so immersive and so realistic that you go in there, and so I knew which tools to use, and I knew, but so that's only part of the story, because then when you have obviously a very realistic environment, and imagine a jumbo jet ready to fly a plane. You don't do that unless you have done hours and hours and hours of simulation. You don't want to have a plane with 500 people and then be learning how to fly. Same thing applies in here. You're really playing with human lives, right? With human health, with the limbs, and in this case. So the other part of the story, as I was saying, is being able to measure. How do you learn? And as a surgeon, we were very a focus on ergonomy of movements, right? You don't want to be wasting time when you do things. If you can just go grab something, you go grab something, not going around and grab something. So a way of in a way measuring this in an objective fashion is having eye tracking, like the Varjo, the VR2 has, like iMotions provide, and not just eye tracking, but many other biosensor variables, which in a way tell the story of how are you doing. Maybe you look like you're doing a good job, but you are really, your heart is racing at 150 beats per minute, and you're sweating, and you're really stressed out, and you're not going to tolerate this sort of pace for more than maybe a few minutes or a couple of hours. So it's really important to achieve that. You probably heard about the zone, right? We want to be in the zone. We want to be in the it's very relaxed and very focused, and nothing else matters but what you're doing. So one way to get there, to train yourself to get there, is having a very realistic environment, which the Varjo and Orama VR provides, but then being able to measure all those physiologic points that iMotions allow us to measure. So when you put all that together, you are not just improving performance, but you are measuring, in a way, indirectly, the performance. So when you can have the same procedure done almost at a gross view in a similar fashion, but you measure and someone's heart rate, is really calm and the GSR, is low and you're not stressed and you can do this for hours and you're enjoying it, you're doing your best possible, having the best outcome, the best result, versus someone who appears to be doing the same procedure, maybe the same time, maybe no errors, maybe everything looked grossly from the outside very much the same, but when you measure the inside and you see that person is really going through a lot of stress and they're not going to be able to, so that person is not ready to fly that jet. So that's kind of the way I see it. So in a way, when I got the set, I actually tried this headset probably over a year ago, but the VR2 is obviously a step up, and then the iMotions capabilities, and you put that on and you start being measured, and it takes a little just being measured, it raises your stress level a little bit, but once you are in there and you forget about anything and you're looking through that window in the Varjo 2, which is a big window. I mean, this is a device that is not, but when you get there and you are completely isolated and you are in that operating room with that patient in front of you, and then you start working, and at the end you see that all your variables, your physiology relaxes and you're doing your best, is really an experience that is hard to describe. And I think it's very important because we're not talking again training for a banal thing. We're talking about training to save lives and to improve someone's health, and that's what you have in your hands. So I believe that certainly simulation. I'm been always passionate about simulation, but also virtual simulation. I think is the not even the future, it's the present. There are several platforms out there: Orama VR, Fundamental VR, also VR. There are many out there. It's not really the platform. That's going to be pretty standard, I think. Kind of like the headsets. The headsets are going to be standard, and all the measuring of the variables is really where the kicker is. And in regards to whether this is something that will completely substitute how we learn, I don't think it will substitute. I think that technology, if we use it in a smart way, will allow us to supplement the way we do it. I'm not saying that you're not gonna maybe use physical models or mannequins of some type to learn some of the ways of doing surgery. You're not gonna not work on human or in animal in vivo models. You're not gonna not work in humans at some point, because as an apprentice you need to be taken through the real surgery by someone who's an expert. So all those steps are part of the training, but this enhances and in a way it really augments the first phases of how to reach that level of the zone and be an expert, and how to maintain that, because that's very important. You don't just learn this and never do it again. It's not like riding a bicycle, really. It's in a way a little bit of riding a bicycle, but you really got to get better, and then stay better by training. So that's why this technology is really, I think, certainly the future, how we're going to supplement how we learn to be surgeons or how to be proceduralists in a way, because it applies to many disciplines, including obviously healthcare and surgery. And I just feel that it's interesting to see how technology has evolved. And in just very few years ago, the Oculus came out and everyone was like, what is this? And we've been having trials at VR for many years, and we are to a point where VR has exponentially spiked to a level pretty much after the Oculus came out, to something like this looking through a window type experience, which is the Varjo, the VR2, the VR1, and and the XR1 as well. So it's really amazing to see this and to be able to in a way collaborate in order to shape this platform the way it should be, because this is something that should be, I think, a part of any surgical training standard. I think that this is as important as going to OR to watch a surgery or to see a surgery, as important as reading the steps and learning the steps, as important as reading the basics of medicine. This is something that is indispensable to make part of a surgical curriculum. So.
Yeah, and to all of those excellent points, especially the one talking about, this is the first step. This is meant to augment traditional training techniques, and really just the degree to which you can improve. We actually have 2 videos showing how a novice who had never used this virtual environment or been in an OR actually used these together. So if we go on to the next slide, this is an example. You can see the visual attention marked by the circles and the lines to show this novice trying to perform this task. And it results in a critical error. And so you can see from the graphs below that the GSR activity actually does peak shortly after the critical error occurs, which could happen right now. I have no idea what I'm doing here, but I do see a big red error. And there's just a sudden backing away. So you can pair the eye tracking attention to the blood that's gushing out of the patient and the actual setup itself to show that there is an increase in GSR arousal paired with where I'm looking, the emergency that's going on. And this was, of course, a first pass. So critical error. And then if we move on to the next slide, this was the 3rd trial, and this was actually a trial with success. So Dr. Grossmann mentioned, newer surgical interns, the heart rate is still going to be high, the GSR activity is still going to be high. You can see that based on the graphs below. I had many EDA or GSR peak responses because I was very nervous about going through this task, but there was a marked improvement based on the procedural, on the process itself. So this is a stepwise process. It's a procedural task, and allowing for this environment makes it a little bit easier to pick up. Dr. Grossmann, I'll turn it over to you for any additional commentary on my my performance here.
I think I heard that the patient did very well, so I think that you did okay.
All right, perfect. Cool, so we're gonna go ahead and switch over to the next slide now. And so this is Dr. Grossmann going through the task. You can see the eye tracking data, and he's much more familiar with the processes and was able to complete each task a bit faster. We did talk about the visual guides, so the novice may depend more or fixate more on those visual guides, whereas the expert is fixating on the tools themselves. So that's certainly something worth noting here. And the task itself is, of course, completed much faster. So that was interesting. And of course, we have an image of Dr. Grossmann wearing the headset in an actual physical operating room, which really adds to the reality of this and the situational memory associated with it. So I'll turn it back over to you for any input and further insights.
Yeah, thank you, Roxana. So yeah, and I for some reason I don't see my my measurements down there, but I can tell you, it's pretty realistic. So it's to the point where the first time it took to it takes a little setting up, I think, to calibrate, the motions, and you're not feeling anything. Your brain is tricking you into feeling, and you feel almost the bone cutting in there, but you don't really feel it. You're seeing it so well. That's why the visuals, that 20/20 human eye resolution is so important, because it's like when you're doing robotic surgery and you don't feel anything because the patient is out there, and you're doing robotic surgery, but you almost feel the tissue, and you feel it because the resolution is so high that your brain you see the tissue deforming and looking differently when you grab it. So it's the same thing in here when you see it so well. So the first trial, I was almost done. I was just basically cutting the bone, and but the angle on the saw was a little tricky, and I went through that, and the blood spurted. I thought, it almost got stained with blood because it looks so realistic. So then when the calibration was a little bit better, then I could take the steps. Very kind of familiar steps in a way, but it's also, you got the visual guides. So to me, it was really, I'm pretty sure my measurements were very relaxed or appropriate or ideal, I would say. The other thing is that the eye tracking, you kind of know what to look for. That the next step is going to be looking, grabbing that if you have the drill, the next step is getting the guides, and the next step is getting the set, and the next step is getting the saw, and so you have that efficiency of movements, that efficiency of where do you look. You're not looking everywhere and what do I know next, or looking for other clues. So I think that the visual guides and the being able to see where your eyes are looking, that's very important. And that's very important, I think, for measuring and for improving then performance, because not just for procedural simulation and training, but imagine for many other things. You could be in a good way and a bad way, but if you want to see the good way of it, if you see where the eyes are looking, that's very important, because when you're learning how to do a procedure or how to maneuver through things, it's really key that you know what to expect next, and that you go there in the shortest way, in the most efficient and most ergonomic way if possible. And I briefly also want to mention, when we started doing VR simulations, it looked like almost like a little video game. You're cutting a knee, or you're doing something in the abdomen, or those little video games to do surgery, to something like this that is very, very realistic, right? And almost fools the brain to think that this is the real thing. And you get almost concerned that you don't want to make a mistake, because someone might, suffer from that. But there's two things that I always talk about, and that's something that with this other company that I mentioned, Fundamental VR, which I have no also conflict of interest with them. They have added a haptic feature in combination with haptX, which is a sort of you can feel the touch on a glove in a virtual environment. So haptX or Sense Glove is another company, and this is going to be pretty routine very soon, I think, because there are other iterations of these products. I think the holy grail of virtual reality training, focusing on training and education, but I think in general in virtual reality, the holy grail is really the feeling, the haptics, because once you have this level of visual, and you're almost looking through that window on the headset, now you need to feel that real image, and the way to feel it is with the haptics. So I think that the visuals, the measurement of the physiologic variables, the biosensors, and the haptics are really a combination that will revolutionize how we train and how we learn procedures.
Yeah, definitely. So I think with regards to the measurements, and this question may have already come up in the questions. If we move on to the next slide, we can kind of talk about the takeaway, right? So there is the actual process of going through the task itself, and that does, especially with the eye tracking, is very beneficial. And so really pairing these two tools together allows not only for, if an individual wants to take a look at their own replay to see if they can gain insights from their experience, or if we want to aggregate this across the trainees, that's something that the tool set that we provide really allows. And this is something that, as Dr. Grossmann said, will become more and more streamlined as these virtual surgical tools become more commonplace in training scenarios. So really what you can do is leverage things like area of interest metrics, such as time to first fixation or time spent on a particular area, and aggregated heat maps of the visual attention. And so this gives you an overview across all of the surgical trainees or participants in a given study. What were they attending to? And so in this example of the heat maps and AOIs, these images below, you can see kind of what the aggregated visual attention on the patient vitals are. So if the vitals start slipping, or the physician's actually looking at the appropriate parts of the display. And so this not only can help with the trainees to know where to attend to visually, but also perhaps for future medical needs, actually setting up the operating rooms in an efficient manner. So that's kind of one of the things that we can take away, and I'm sure Dr. Grossmann has more to add on some of these output measures as well.
Yeah, no, exactly as you said, Roxana. I don't think I have really much to add. I think it's so important, to be able to measure those, those metrics. That's really key to improve, I think, and to measure improvement. Yeah,
definitely. Improvement and performance feedback, I think, are really the main takeaways here from what we can leverage these tools with. So I think that was it for our overview. If you want to move on to the next slide. So what we're going to ask you next is just a quick poll. If you are interested in learning more about iMotions, Varjo, or anything that we've shown you today, please go ahead and fill out this quick poll. and we'll give you a moment to do so. And then once you've gone ahead and filled out the poll, we have a few minutes left for Q&A. So we're going to go ahead and pull up some questions and ask those in just a moment. Okay, we're just going to give everybody another moment to fill out the poll. Okay, great. So now to the Q&A session. All right, so the first question we have, I think I'll just go ahead and read it and we can go ahead and respond accordingly. The first question is, have you explored the use of surgeons that are nearsighted and farsighted to assess the ability to work for extended periods?
You know, I'm not very familiar with those details. I know that you can calibrate the headset, and depending on the headset, you can wear glasses. Maybe Geoff has more input into this, but not because he has glasses, because he works with Varjo, or both. But you know, I think that you can really calibrate the device in a way that I personally don't wear glasses. I think that it obviously has to be a must, because you need to have to be able to accommodate, right, any sort of visual you know, acuity in order to be able to use the device. I know that in other headsets you can certainly also do a similar not as good but similar calibration to correct that deficit.
Yeah, and what I would just add is that our headset is specifically designed to accommodate glasses. So unless you have glasses even much bigger than these, you can put the headset on over it and just, you know, goes on and off easily.
Yeah. So a follow-up question to that in a similar vein that I think is for Jeff is for Jeff and for Dr. Grossmann. Sorry, the questions are coming in very quickly.
Oh yeah.
So similar to the nearsighted question, have you explored users with varying degrees of myopia, hyperopia, presbyopia, and assess the impact of IPD on user fatigue?
I can take that one.
Yeah.
I'm not sure what all those conditions are, but I know that the one advantage that we have here is that our eye tracker is per eye. So for subjects that have strabismus or other conditions that would lead to varying measurements between left eye and right eye, we do accommodate that, but we haven't done any medically rigorous studies with specific conditions.
Yeah, and I would say, you know, when I had the device in my head, you know, when I got it, I had to calibrate not just you know, the clarity, right, of the depending on my eyesight, but also you know, you have the IPD, the interpupillary distance, right, that it's also a variable. And then finally, when you calibrate the eye tracking, you know, you calibrate the eye tracking, and you basically do a series of you know, maneuvers in order to know exactly where your focal point is, independent of where your eye normally, I mean, where you normally see is what you're going to see on the device. So if you have glasses or other corrective ways, then when you put the device on, you're going to be seeing exactly. That's why I'm saying it's like looking through a window. You're not really changing anything. So in that sense, is I think very easy to I think to address those issues. I don't think I personally, and I don't think they have studied that specifically, but I think it'd be a good really field to maybe study, and also see how those biosensors maybe measure differences. But in reality, since you calibrate the device, I think that the difference wouldn't be tangible, I think.
Yeah. Okay, so this next question is for Dr. Grossmann. Do you think a headset like the XR1 could be helpful to show medical data and real-time guidance during a surgery scenario?
Yeah, well, I hope so eventually. These devices obviously are still, although they are really the result of I mean, they are the top of the course in regards to the evolution of the devices, right? They're still devices that, I mean, you wouldn't wear a virtual reality device during a medical procedure or during a medical act, even, like even seeing patients, because again, virtual reality, as we all know, it's immersing you, fully immersing in digital environment. It's not like AR, where you have a digital environment superimposed in the real environment. If you have a device like the Magic Leap, if you have a device like the HoloLens, and even the Google Glass, was the first. I was the first surgeon who ever did a live surgery during wearing Google Glass, and that was, I think, the first iteration of having an augmented reality. I was seeing through, and I had the little glass cube, and I was seeing a digital image, sort of almost floating, right, superimposed in. So you can use devices like this during a live surgery or any medical procedure, because you're not fully excluded from the real environment of the patient himself or herself. Device like this is certainly not possible, not to this point. I'm pretty sure I know the XR1, I believe that's the proper name, right? The XR1, Geoff?
Yeah.
So the XR1, I had the chance to use it. I gave a keynote recently at the FDA, and we actually brought the XR1, and we had a live demo during part of my talk. And that device allows for VR and AR, so you can see through the device, and you can have. So that device definitely, once the device evolves some more and becomes smaller, and is a very ergonomic device, but still it's heavy in a way. So despite the great design, you still, you wouldn't be able to wear the device for 2 hours during surgery, but you could potentially have an evolution of that device during surgery, like we have plenty of data now that shows people using, for example, HoloLens during medical procedures in interventional cardiology, for example. Dr. Atul Gupta is doing that, along with Philips and Microsoft and Philips, and also devices like the Magic Leap, which I'm a healthcare advisor for Magic Leap. Magic Leap has paired with Brain Lab, which is like a very well-known company in surgery, and that device can be used during the diagnostic phase of surgical procedures, because you see through and you see basically a 3D representation of a radiologic images, for example. So those devices are certainly the future, and I have no doubt it's going to be the same for a device like XR1.
Yeah, certainly. So we have time for a few more questions. So I think the next one is for Jeff. In your experience, does the Varjo tracking and resolution decrease the sense of nausea seen that in certain percentage population with VR?
Yeah, I mean, the short answer to this is yes, but the long answer is we don't have like a rigorous study, so it's all anecdotal. But what we've seen over and over again at conferences with end user feedback and everything is that we do have a much lower incidence of nausea and simulator sickness. And I think that's really due to two main things. One is our eye tracking allows for an automatic IPD adjustment. So what this means is that every time someone puts the headset on, it's adjusting to their specific interpupillary distance. And I think that that's something that when the setting is manual or different in other headsets, it's much less reliable and much less precise. So sometimes people don't do it, sometimes they do it wrong, and it can lead to a lot of sickness. And then I think the other thing is that really I do think the resolution contributes to this, because when there's things like the screen door effect, I think your brain is fighting competing signals about what you're looking at. And when you can see something that's really sharp, that's very realistic, you're less distracted, you're not having competing signals, and you can focus more on what you're doing.
Definitely. Thank you. Okay, so another follow-up for Jeff. How do I access a library of environments that work for Varjo?
Yeah, so that is a great question. Orama VR is a great one, and we've used their content for this webinar. And then we also work with a bunch of other engines and content developers. So there's lists available. You can contact us, and also anything that's built in Unreal and Unity, we do a really good job of documenting the port over. So generating content in Unity from scratch that's compatible with Varjo, or migrating something that's already made is actually quite simple, and it has basically to do with just converting a 2 viewport rendering, a left eye, right eye, to 4 viewport, where it's left eye context and focus, right eye context and focus. And we have lots of good resources and we are happy to also walk people through making their own.
Okay, so question now about the iMotions platform. What are the data analysis options? Can we define AOIs? Yes, so certainly within iMotions, there are a number of different analysis tools available for visual attention and eye tracking, as well as some of the other measures we integrate. So you certainly can identify areas of interest and get typical measures based off fixation or gaze from those AOIs. You also are able to generate aggregated heat maps and really leverage our advanced gaze mapping technology. So in virtual environments, for example, you can imagine that each person is going through at a different rate, might do things in a slightly different order, and you can leverage our gaze mapping technology by taking providing a reference image or a screenshot of a scene that everyone will see at one point during the virtual environment, and then literally map everyone's gaze onto that reference image, allowing for aggregations and added insights there. So those are some of the visual analysis tools we have available. We also have a series of built-in signal processing flows using our notebooks, such as EDA or GSR peak detection that separates out the phasic and tonic levels of the EDA signal, allowing for insights into things like EDA peak detection. We have a number of analysis tools integrated for ECGs, such as heart rate variability, as well as other signals as well. So we've tried to expand our built-in library of post-processing tools, and certainly have been mastering the visual attention ones for about over 15 years now. So we do quite a bit available, as well as full raw data export. And then the next question for Jeff and Rafael, this is a COVID-19 hygiene question. Topical.
Thank you.
In light of the corona disinfection, is it necessary to clean the mask between participants? Assuming that cleaning the mask with alcohol gel is not recommended. And follow up, are you considering using the well-established use of UVC light as a way of cleaning 99.9% of the virus and bacteria?
You said UV light is what you said?
Yeah, UV light or other cleaning techniques.
You know, I can maybe start the answer. That's a great question, by the way, because a lot of these technologies, like many things in life that we used to do before the COVID-19, now we have to do different, or at least thinking differently, right? And so it's a good time to say, you know, I preach social distancing and wearing masks and, you know, being prudent, because the consequences of not being prudent can be devastating in this particular pandemic. But there are companies out there, especially I want to talk, and again, without any conflict of interest, to declare Clean Box, for example, is a company that has been created and thought of as a company that devises a way to, in a very easy and very, in a way, inexpensive, and especially a successful way sanitize or sterilize devices using UV light. It's not just an UV light that you buy a bulb and you put it there. No, this is specifically engineered to put a headset or a number of headsets within a box. A clean box is the name of the company, clean box, and basically attain this goal. So it's been very, very, I would say, popular, growing tremendously, and to also a company that also was in a way obviously affected by the COVID-19, in a way that they have been redesigning, reshaping their solution in order to sterilize masks, for example, N95 masks. So the answer is yes. There is ways to sanitize, and if you go to a conference, the old way of cleaning the device with specific antiseptic or sterilizing solution, and Geoff can probably talk about that, because it's a delicate device. I think in that sense, you don't want to clean it with some Clorox or something, I would think. But there is a way, very professional and very successful, of sterilizing these devices to allow for inter-uses. And that's very important, because VR in healthcare is here to stay. You have people like Dr. Brennan Spiegel at Cedars-Sinai that really is one of the pioneers in this field. VR devices are going to be there for providers and for patients. VR is therapy, VR is to learn, so VR devices need to be safe to inter-use.
Yeah, and I think we have time for just a few more questions. So this next one again for Dr. Grossmann. Have you used machine learning to change the training to suit the trainee? For example, stress management training tailored to use?
No, I haven't, but I've seen examples of this, and obviously, when we talk about exponential medicine, we have to talk about AI. I think AI is been here for decades, and it's just being talked more about these days. I've been also very passionate about studying AI and how that applies to learning and to healthcare. Recently finished a course at MIT that deals with AI in business and in healthcare. And AI is machine learning, is robotics, and is natural language processing. All those three apply for something like this, for example. And absolutely, you can imagine how visual recognition, step recognition, variable recognition, biosensing variable recognition can be in a way optimized, and imagine even given clues or stimuli in a good way or a bad way to someone who's learning, in order to guide them through getting to that zone, to that area in a faster way. That's all possible, and there's so many things that we can do. I think we're only limited by how creative we are. I had a question for Roxana that I wanted to maybe plug in here, that or for iMotions, but EEG, for example, we see devices like the Muse device, right? It's a headband that measures your EEG. It's like a portable EEG that has evolved obviously over the last very few years, and you can play with your EEG, with your electroencephalogram, with your electrical brain activity, and you can modulate that and learn to give yourself feedback, biofeedback, in order to reach that level of calmness. So something like this would be, I think, really interesting. And maybe they have done it already, but I think that measuring EEG among one of those variables, physiologic variables, would be very, very interesting, because you can see someone reaching that level, and maybe the room color might change, or maybe the setting might change in a way if you're getting more and more relaxed and you're getting there, and you can try to get there faster. So these are very exciting fields of research, I think.
Yeah, and to follow up on the EEG overview, I've spent many years of my life using many different EEG systems for my graduate research, and of course at iMotions as well. There are many consumer grade systems out there, like the Muse and others, that are meant for consumer use, meditating at home, trying to introductory education into what EEG even is, what are these signals. And then there are the more heavy research grade ones that provide more of these insights and allow for some of the heavy biofeedback. So certainly the biofeedback is a very interesting field, and it's used broadly from addiction research to behavioral therapy, and others. And I think that there are many applications for that. The challenge with EEG has always been that there is a lot of noise. It is picking up electrical signals, very mild electrical signals from the surface of the scalp, and it has to have really good connection to the scalp. And follow up to that, the reason that it wasn't really accessible by the public for decades is that because it does require quite a bit of signal processing expertise to really properly clean the data, depending on your research question and what your insights are. So now that there have been advances in these tools, it's still a bit tricky to use, especially in virtual reality settings, just because not only is there movement from the headset itself on the participant's face, but there is electrical noise from the headset itself that may interfere with the signals picked up from the scalp. That being said, I don't think that it's impossible. I think that someone really clever out there will come up with a really good solution to this in probably a few years. So I'm looking forward to that day when that happens.
Me too.
Yeah. Okay, so we're gonna go ahead and I think stop at this point. We've had some really solid questions. I'm gonna go ahead and thank the panelists and all the attendees today. Everyone who's attended, you will receive, or even sign up, you will receive a recording of this webinar in the next few days. And again, super special thank you to both Jeff and Dr. Grossmann. You guys are amazing, and this has been a really fun experience. So I'm glad we were able to pull this together and do this. And on our final slide, we actually have our contact info. So if you want to get in touch with any of us, please go ahead and connect with us on LinkedIn. You can tweet Dr. Grossmann, and I've also included our colleagues over at Orama VR's information in case you want to get more information about that environment as well. So go ahead and reach out to us if you have any additional questions. Connect, and we look forward to hearing from you all soon.
Thank you so
Roxana.
much.
Thank you, Geoff.
Thank you, everybody.
Thank you, all of you. Thanks.
Bye.
Have a good day.